Well, Community Health Network says Hoosiers will now have easy access to some of the best cancer care in the nation through its new partnership with MD Anderson Cancer Center in Houston. Business of Health reporter Kylie Valletta has more. Kylie.
Thank you, Gary. The MD Anderson Cancer Center ranked #1 for cancer in U.S. News and World Report's most recent list of best hospitals in the country. The new partnership means patients at Community will now be able to take part in MD Anderson clinical trials and research studies right here at home in Indiana. Dr. Sumeet Bhatia is medical director at Community MD Anderson Cancer Center, and he joins me now to tell us more about the new partnership. Thank you for being on the show today.
Thank you for having me.
So this is really all about bringing some of the best resources from one of the biggest cancer centers in the country right here to Indiana. Can you explain at the end of the day, what does that mean for patients here in Indiana?
Community Health Network has essentially been the last mile in providing cancer care to our patients here. 10 years ago, through affiliates practice, we partnered with MD Anderson to bring their standards here. Last month, we went into a partnership mode, which essentially we adopted all their practices, including multidisciplinary care, opened up our doors for more scrutiny to essentially follow all their practices, pathways, but more so importantly, get access to their clinical trials and drugs for our patients over here. Essentially, it is about delivering the best care in the country here and now through a partnership or creating a superhighway to the hospital, which is regarded as the #1 provider of cancer care in the country.
And you mentioned the access to clinical trials, and really what that means is getting access to drugs that really aren't even on the market yet, right?
Yes, drugs which are not in the market or drugs which are not FDA approved. And essentially that can offer a huge cost savings to patients because those drugs, when on clinical trials, are essentially free. So for example, there are drugs which cost almost $500,000 for a year, and patients who are on those clinical trials can get access to them not only earlier, but also in a very controlled way where they are watched in. And this can, we believe, result in better outcome. It also keeps the patients at home. Right. They don't have to travel.
Exactly. You mentioned this sort of shifts Community from being like a 9-county provider to really statewide, and even making it a destination for patients in the Midwest.
So our underlying contract with MD Anderson allows us access to their pathways in Indiana, Kentucky, and some of the surrounding states. Our hope is that patients in those surrounding areas will be able to access some of their care right here in Indianapolis rather than having to go to Houston. Right. We will partner with their physicians to provide them care right here.
And we want to look at this a little bit through a business lens. So we're not going to see new buildings being constructed or anything, but there are important investments taking place internally, right?
So there will be some new buildings, but this is more a software upgrade. The hardware will be upgraded, but it's the software. We are going to invest in physicians, programs, processes, clinical trials. A leading example of this has been our phase 1 clinical trial, in which we recruited Dr. Bert O'Neill. And in the first 6 months, even before this partnership was announced, he arguably became the largest provider of phase 1 trials in the state.
And I want to talk about one more thing. We have about 30 seconds left. I think it's interesting, too, that now community doctors are going to have direct access to MD experts at MD Anderson to really consult on cases.
We had that before, but right now they are going to be linked into our individual multi-specialty departments with designated physicians. Case in point, Dr. Kantarjian, who's a leading leukemia doctor in the world, participates in our conference and vets pretty much all our care over here. This was unheard of before.
That's great. Well, thank you for being on the show today, and congratulations on the new partnership.
Thank you.
Gary, back to you.